going through limb lengthening, here's what to expect when it comes to pain in the first few months after surgery. Today we're going to talk about the 3 phases of pain after limb lengthening surgery and how to manage each one. So first up, we have the immediate post-surgical pain phase, which is usually during the first 2 to 4 weeks after your surgery. You'll likely experience inflammation and swelling, which is totally normal. Your body is just starting the healing process. Now, to manage this initial pain, your surgeon's going to prescribe painkillers, and it's super important to time them properly, or else it can get worse and be harder to manage along the way. Resting and elevating your legs is also a good idea, along with using ice packs and compression. So 2 little side notes really quick. A patient who recently underwent femur lengthening surgery shared some information about the lesser used yet potent buprenorphine with less side effects than typical narcotics, and he has research to back it up, and I'll likely shoot a video on this at some point once I've dived into his literature. And the other interesting thing that I've learned from talking to hundreds of lengthening patients over the years is that athletes, yes, athletes seem to experience more pain in the initial post-surgical pain phase than non-athletes. Now, I'm not exactly sure why, but it might be due to their increased muscle mass, which can lead to more swelling and bruising and contusions. But the good news is that these same athletes often have a higher pain tolerance and tend to recover faster than, the other average Joes in the later phases, like the lengthening phase and the consolidation phase. So it's a nice little trade-off, I'd say. Regardless of your athletic background, the initial pain phase usually will subside in a few weeks. But remember, everyone's different, and it's crucial to follow your surgeon's advice and attend all of your checkups for a smooth recovery. All right, now let's talk about the lengthening phase pain, or as I like to call it, growing pains. This is where things can get a little uncomfortable. The pain typically kicks in after you hit your muscle reserve slack threshold, which is the point where your muscles and tendons and nerves get stretched beyond their normal limits, okay? We're talking about 3 centimeters or so on the tibia or the shin bone, and about 5 centimeters or so for the femur or the thigh bone. But like I said earlier, everyone is different, and your experience might vary. The more you lengthen, the more the tissues get stretched, and this can lead to more discomfort. Here's the good news. There's a few ways you can kind of mitigate the pain throughout the lengthening phase, and that is 1, stretching pre-surgery, 2, doing a lot of physical therapy consistently throughout the lengthening phase, and 3, timing your pain pills and taking them as needed, prescribed by your surgeon. And if your pain is really bad towards the end of your lengthening phase, which it might get that way, especially if you're going for the more extreme amounts, then just let your surgeon know, and they can monitor your progress and possibly even adjust your lengthening rate so that your body can cope better with the distraction. And finally, we're in the consolidation phase. This is the home stretch, if you will. This is where your new bone starts to harden and fills in the gap, and your body adjusts to the new length, and you have increased height. But don't think that you're off the hook just yet. No. You might experience what I call healing pains, okay? This is as your muscles start to reactivate, as you become more mobile. The pain is a natural part of the healing process. You're gonna likely feel very stiff in some mornings. You're gonna feel sore as your body is using more muscles to get back to your normal life. And this is all because your body is adapting to the new length. So think of it as breaking in new pairs of shoes, okay? It's a little uncomfortable at first, but it gets better and better over time. And to manage these healing pains, you need to keep up with your physical therapy, okay? A lot of people ask, hey, Vic, do I have to stop physical therapy, in the consolidation phase? You can reduce the amount that you do physical therapy, but do not stop it, okay? You need to kind of gradually increase your activity levels. Heat therapy and gentle stretching also works wonders. So don't stop your mobility. I know a lot of patients, what they do after they get into the consolidation phase is that they just sit and they say, oh, well, I'm waiting for my bones to heal and I'll start walking. Why am I walking weird? Well, because you stopped doing your stretches, you stop doing your walks, your strength training, all of that stuff. That needs to continue and actually get more progressive as time goes on. So that is a big tip that I want to hand to you. But remember, staying active is really important for recovery. Don't push yourself too hard. Listen to your body. Take it slow, okay? The duration of this phase usually lasts anywhere from a few weeks to a few months, depending on how much you've lengthened. But the good news is that the pain will eventually decrease as you get stronger, as your tissues continue to heal. So just be patient. So remember, every phase of limb lengthening comes with its own unique challenges. So stay patient, trust the process, lean on your surgeon and the support team here at Cyborg for Life. during your lengthening process. And if you're currently lengthening, I want to hear about your experiences about the 3 phases of pain: post-surgical, lengthening, and consolidation if you've made it there. Share your stories in the comments below. It might help others who are going through the same journey or that will go through the same journey in the future. And as always, if you found this video helpful, go ahead and hit that like button. And until next time, this is Victor from Cyborg for Life, signing out. Peace.